Welcome, my friend, Dr. Art Hiranyakas. Dr. Hiranyakas is the chief of the Colorectal Surgery Institute at Bangkok Hospital Phuket. Dr. Hiranyakas is also the Secretary General of the Thai chapter of the American College of Surgeons. Welcome, Dr. Hiranyakas.
Hello, Professor Wexner. Thanks for having me.
Appreciate your being with us this morning. You're in a country which was very early on the scene of COVID-19. In fact, back in mid-February, I know there were a lot of travel restrictions already for people coming and going to Thailand. Can you firstly explain to us how the country reacted on a national governmental level, and then secondarily on a local hospital level to the initial outbreak in February?
So the fact is that the government, the whole country is aware that one of the famous destination for Chinese people to come and to travel is Thailand, in particular Bangkok and Phuket. So that's why the government and everybody in the country, once we knew about this outbreak, so we kind of like alerted very quickly and planned to have a relevant plan for the whole country. So we started to plan since February this year, and then we first monitored all the tourists at the airport and everybody who's traveling in the airport in major cities in Thailand, such as Bangkok, Phuket, Chiang Mai, Hat Yai, around the country, the whole country. And then we found that the number of infected people has been increased. So the government, especially the Department of Health, they decided to close the country very quickly, and then they recommended to not allow any international flight to come to Thailand. I think that was back in March, and then the isolation and then the shutdown plan has been more strict over time, since we had seen the increase of the number of infected patients within the country. So we started to do the curfew, so everybody can go out until 10 p.m. in the evening, and then again at 4 a.m. In the morning, and then close down all the business except for, of course, the hospitals, and it's very difficult to anybody to travel, even around the country, around the city, and that has been suffered a lot of people as well. But eventually it worked. The number of the infected people has been decreased, and today we have about 2,900 infected people reported in Thailand, and we had about 54 patients passed away with COVID-19, and that's about 1.8%. And those about 26,000 patients has been treated and recovered and went back home, and the success rate of the treatment is about 90% in the whole country. For Phuket, we have so far 214 infected people, and we had 2 patients passed away. Today, for the whole country, the infected people reported to be 7, and in Phuket, just about 3 infected people. So it's quite good.
Yeah, my congratulations on keeping the disease at bay thus far. To put those data in context, what is the population of Thailand and of the big cities, for example, Bangkok and Phuket?
The whole country, the population is about 70 million, and Bangkok, I think it's about 8 to 15 million. Phuket ourselves, about, I think we have the registered population in Phuket is not much, it's like about 500,000, but including the tourists and expats would be around 2 to 3 million.
Okay, so for a country of 70 million, certainly a good job was done in keeping it down with the curfew and closing businesses and shutting down travel. The other aspect, of course, is at the hospital level. So what measures were put into place when you realized that COVID-19 had reached Thailand? What was done in terms of personal protective equipment, in terms of the way patients were treated, availability of testing in your hospital?
Since we knew in February that the outbreak is coming to Thailand, we started to check the temperature of everybody coming to the hospital, trying to trace back the history of whether or not they've been traveling to those infective areas, and then try to have them tested for COVID-19 at early stage. And if we found anybody with COVID-19 positivity, we send it to the certain area or the certain hospital who would be responsible for just this group of patients. And for those patients, since we practice surgery for those patients who would come for elective surgery, we would allow them to go on with the surgery, especially for those cancer patients. So we, for elective cases, we have them tested for COVID-19 prior to the surgery, and that would take about 4 to 6 hours before the test results would come back. And then for all the emergency cases, we would do the surgery right away, and then the test for the COVID-19 would be done as soon as possible. But for all the patients who would go for surgery or even endoscopy, we would recommend all the surgeons and all the crews in the theater to use universal precaution with full PPE. So that's why we haven't been, especially this in our hospital, Bangkok Hospital, we haven't been reported the surprises of infected cases during the surgery, and we would make sure that all the crew member who would be together in the theater during the surgery procedure would be safe from the disease.
The full PPE, as you refer to it, includes an N95 mask then for all surgical procedures and all endoscopic procedures?
Yes, it would be including face shield, N95, and then goggles, and then the waterproof gown, and the shoe covers for all cases, including endoscopy.
Even if the tests are negative?
Yes, Prof. Even if the test was first negative, because we also have the regulation of following up every patient underwent all kind of procedures, endoscopy or surgery, to have them tested at day 7 as well, to make sure that they are not those asymptomatic patients who would be carrying the disease later on. So that's why we can control the number of infected patients, and at the same time to protect the crew members, nursing staff, surgeons from getting infected from the patients.
Thank you. So two questions which would follow on. Number one, have there been any patients in your hospital who tested negative, underwent surgery, and then turned out to be positive, is the first question. And the second is if there's any difficulties in getting all the PPE you need to keep everyone protected.
Right. Yes, in headquarters, Bangkok Hospital Bangkok, we had the first COVID positivity case. It was a patient who came for elective hip replacement surgery, and we tested COVID tests, and then it was negative at first. And after the surgery, we followed the test the second time, and it was negative. But the third test turned out to be positive. So that's why we have learned that the tests for COVID-19 may not be 100% reliable. So that's why we would recommend all the surgeons and nurses and anybody who would be in the theater during the procedure to protect themselves with full PPE.
Okay, so has there been any difficulty in getting that PPE? Any shortages of PPE given the universal use?
Yeah, luckily it's not the supply for N95 and all those PPE is not the situation for the supplies. Is not that bad in Thailand. We still can find and use them, but even that we still using the especially ACS recommendation for reusing N95. So we do that too to save the PPE. Usually for myself, I would be reusing my N95 about 2-3 times before throwing it away.
Okay, and what do you do between uses with the mask? Is it treated in any way?
Yeah, with the mask, if it's soaked or getting dirty during the procedure, of course we would throw it away right away. But if it's still in a good condition, then we put it in a dry place and then make sure that it's been there for 2-3 days, because it's been reported that if there would be no host for the virus to get infected, even though it's stay on any kind of mask, for 2 to 3 days it would die out. So we took that recommendation from the American College of Surgeons and practice as to follow the guideline, and we reused the N95, and so far it's been no problem.
Good. Sounds like it's worked out quite well.
Right.
Final questions relate to public testing. What is the availability through the country if somebody says, I'm not having surgery, but I'd like to get tested? Is that a possibility now in Phuket and Bangkok, Chiang Mai, and the larger cities?
Nowadays, like in the past, it's not possible because we could imagine how many infected people would be in our country. So the government was trying to save the test for those who had indication to do so. But nowadays, the country is kind of open for anybody who would be who would like to have the test tested. And even the government is very proactive nowadays in any area which reported to have lots of infected people coming from. They would go into the community and test all those asymptomatic patients. And if we find one, we would isolate those patients in the hospital. We nowadays still admit all the patients with positive test, even though they don't have symptoms.
Very interesting. Are they segregated in a certain area of the hospital with only positive patients and negative COVID-19 negative patients or elsewhere in the hospital?
Right, because we built, especially in Phuket, we built 2 new hospitals outside the standard hospital just to take care of those positive tested patients without symptoms, and those PUI patients, make sure that they are well isolated, not spreading the disease to any other people, and at the same time to save the real hospital beds for those patients with other conditions as well.
Well, thank you very much. Certainly very enlightening hearing the way the COVID-19 pandemic has been handled in Thailand. It's different than it is in other parts of the world, and I commend you for your work there with these patients. I know that you had a huge international meeting planned for November that's been postponed, and I'm disappointed I won't get to return to one of my favorite countries. But
Thank
hopefully, when this pandemic is all behind us, we'll get to see you in person. And in the meantime, I wish you and your family sustained health and safety throughout this crisis.
Thank you, Prof. And then we are looking forward to organize the meeting, the international meeting next year, 2021, around perhaps August or November. And it would be our pleasure to welcome you and Dr. Burkle to visit us once again, and then including the other faculties from around the world as well, Prof.
Thank you.
Thank you, Prof.